back to Beyond the Diagnosis. We have our dear friend, Raeshon Williams, back with us. So excited. Everyone, round of applause for Shawnee. Yes, so we are going to jump right in. And before we get into the nitty gritty of what our topics are today, I want to ask you, has anyone reached out and told you what their biggest takeaways have been so far from our last interview?
Actually, yes. Again, first of all, thank you for having me back on. And then, yes, I have gotten, I actually kind of like forgot because it's that we did this because it's just like having a regular conversation between you and I. So when someone was like, oh, I watched and it was so great. And I was like, what are you talking about? But then I remembered. So yes, great reviews on just like like I told you, our banter, just going back and forth, sharing information with each other, feeding off of each other, and all for the sake of helping another person or another community, the community in total. So I think I would say the biggest takeaway was that they felt like they were kind of like in on the interview, like just sitting in our living rooms, having conversations. And then also, anytime that you can take anything away from a conversation is always a plus. So being able to sit in on our conversations and take something away, that's a plus.
I love that. I love hearing that. That was our prayer, is that these episodes should be a blessing to anyone who tunes in while they are targeted toward the pancreatic cancer community, because our community is very isolated. And even though we are a large community, because we're not just national, we're not just local, we're a global community. We
Mm-hmm.
meet people in Europe, all in various countries, and then we also have a lot of PanCan impacted people in Australia as well. So our community is quite large. And you would think, as big as we are, that we wouldn't be so isolated. So
Right.
even though these episodes are targeted specifically toward the pancreatic cancer community, it is a blessing to hear from others who are not a part of our community, but still have learned a lot and have been well informed and educated as a result. We are happy to let you all just sit in on our discussions. These are regular conversations and dialogues me and Shawnee have on a regular basis, with both of us being in healthcare in our respective capacities. And both of us are hypochondriacs. So we just care a lot about health in general. So we're always having conversations about God, having conversations about how we believe the Lord has called us to help our communities in the healthcare space, and how we help one another. She learns from me, I learn from her, and it's a constant exchange of knowledge and education. So we are so excited to have her be a regular part of our lives and our community. So today's topics are really going to hit home for many people. Again, we experience this within the pancreatic cancer community as families. And I believe anyone who's diagnosed with any type of cancer is going to be able to relate to this. But also, people who go to the doctor in general are going to be able to glean from what we're going to be talking about today. So, two things we are going to be discussing are: number one, how to maximize your 20-minute visit with your doctor. And number two, how do you understand your labs? And I thought that would be the perfect discussion,
Yes.
because while we do know all physicians are not created equal, I do
Right.
believe that the ones who are phenomenal get a bad rap. It's kind of like that proverbial illustration, if you will, where it's like one bad apple messes up the whole bunch. But it's not the case for the healthcare space. We have excellent nurses, we have excellent allied healthcare providers, we have excellent physicians that exist. And we want to give you all the behind the scenes of what they're actually up against and why you all are not able to get what you believe you deserve. It actually is not up to the doctors and nurses at all when it comes to what kind of time or how much time they can spend with you. Many physicians complain themselves and are advocating for ways in which they can spend more time with their patients and not feel like they're in a factory, if you will, almost like an automotive factory where you're just putting parts and everybody's just passing something along. Physicians hate that. They don't feel that they get enough time to get to know you. They don't feel like they get enough time to be as investigative and really express their passion and why they got into the medical field in the first place. You know, many physicians, when they go to medical school, it is because they want to help people, contrary to popular belief. They specialize because they want to help people. They don't want to see people sick. They want to see people thrive, and they want to actually see you less in their office. They would
Correct.
like for there
Wellness
not to be.
visits.
Yes, they want wellness visits. They want to see an increase in that. They want to see less visibility in the ERs, less visibilities with beds being full. You know, they would appreciate a low census. So we're going to dive into those things and really tackle the behind the scenes just to help you all understand first their point of view as the provider, and then as someone who desires to have the kind of time you're looking for so that your nerves are calm, so that
Yes.
you're encouraged as the family. How do you now maximize that time? So the first question I want to start with is explain the structure for physicians. Why do they only have 15 to 20 minutes with a family?
So, this is all information that I've been kind of experienced through, not definitive or anything like that. This is all just experience based knowledge that I will be sharing. Um, while working in home health, I think that was the very first time that I realized that how much time we were allotted to spend with each patient. And I'm not even a doctor, but being a medical professional or a healthcare professional, which is why when you go to the doctor, you see the nurse more often than you see the doctor, or for longer periods of time than you see the doctor. I would say that I believe that they're given a certain amount of time, 15 to 20 minutes, or maybe roughly 23 to 25 minutes with each visit, because one, you see an increase of patients that are coming in. And two, if you spend 40 minutes with one patient on each, then that means in an 8-hour shift, you're only going to be allowed to see X amount of patients compared to however many. So if we want to make, from a business perspective, if they're wanting to make more money per visit, then, or the amount of money that they get paid per visit, if they're wanting to make more revenue, then that means that we got to put the doctors on, like you're saying, this conveyor belt, and make sure that they're seeing multiple people. So in order to do that, we're only going to give you a small allotted amount of time to spend with each patient that you're seeing. So instead of you seeing 4 patients in a day effectively, now you have to see 8 patients in a day or 10 patients in a day, because let's not forget, they still got to take their 15-minute breaks and their lunch break if you want a good doctor or an effective person. So I think that that's what it kind of stems from, just the business perspective and how much money they could make per visit.
Makes a lot of sense. Business wise, it does make sense. I believe that one of the things I've struggled with, because it's the same thing in the spa industry,
Yeah.
they want you to spend less time over here. And you're starting to see it in a lot of physical therapy spaces as well, where they're bringing down the visit time. I think that my issue with that is when you don't give the doctors control even of that 20 minutes.
Correct.
That's where we're seeing the gap, because you're telling me I only have 20 minutes, but now you're piling up my schedule
Correct.
versus saying, hey, we do want to be able to see more people, but we still value quality of time. So this is how we'll help you to structure your day. And that is the issue that I find. Because when I was working in the spa, yes, I used to be a massage therapist. No, I do not do that anymore.
A great one. You missed it. If you missed it, you missed it.
I retired myself. Um, But when I was working in the spa industry as a massage therapist, one of the issues I had was that conveyor belt feeling, and it took away from the humanness. You know,
Correct.
we are dealing with people who are hurting.
Right.
As we talked about in the last interview, if you have not seen those three parts, go back
Run it
and tap
back.
in because we had a great time. Lots of gems dropped. One of the things we talked about in that three-part interview was understanding that people are anxious, they are fearful,
Mhm.
they are confused. Diagnoses come out of nowhere. Nobody knows why something happened. You have so many risk factors that contribute to a person's condition. It could be hereditary, it could be environmental, it could be dietary, and lifestyle. How do you eat? Um, do you exercise? Do you live in food deserts?
Right.
Do you live around plants and areas that have a lot of chemical waste? They're doing a lot of studies on that right now. I just saw a documentary not too long ago on Instagram that one of the family that I've connected with shared, and in Iowa, they have linked one of the causes for increased cancer risk to the water and the pollution of it
Ah,
around there, and the irrigation system, and it's a lot of farming and agriculture there, and how that's impacting the towns surrounded by there in the cities. So even whether you're in a large city or you're in a small town, we have to think about those things. Me and Shani are both from LA County. And anybody who's familiar with LA County knows that yes, it's sunshine and it's palm trees, but there's also smog. We have a lot of plants and factories. Okay, we're surrounded by ports because we're surrounded by water, and so
mhm.
there's oil rigs and you name it. We have that going on, and so we have our own share of risk factors that we have to consider as LA County natives.
Right.
So when you take all of those things into consideration, and then you tell somebody that they only have 20 minutes to come in and see a doctor about something that they don't even know the cause of, and let's not mention the fact that since COVID, now
Oh.
you may only get an appointment within 5 to 6 months.
Oh, right. Right. Correct. So
So would you
let's
like
not
to
talk
talk
about
about
going to
that?
the emergency room and then them saying, okay, follow up with your primary because there's a issue, there's a concern, you need it to be seen. So you go in and then they say follow up with your primary, and then you call your primary and they say, oh, we can't see you for 90 days. A whole lot can happen in 2 days. So
Yeah.
90 days, again, just the saturation of people. It could also be the decline in healthcare professionals because you do
Mhm.
have this time frame, this constriction or restriction that we're working, and you feel constricted. I can honestly say that I have noticed that even being in the last 20 years of me working, like the first couple of years of me being in the nursing field was a little more fluid, a little more, understanding and easygoing, and being able to be more of a patient advocate, and developing that nurse patient relationship. Now it's kind of like get in and get out. So I've kind of mastered how to um, do an assessment while also treating the person like they are a person and not a task. So each question that I'm asking you is just a conversation that we're having, but I am gaining so much information. I am looking at you. I'm assessing you head to toe. I'm seeing if you have any grimaces. Are you guarding one area? So now when we talk about pain, if you say like, I'm looking more so into what you're not saying compared to what you are saying, and then we can hit those targets quickly. And that is, again, that's just evolution of how nursing in the medical field should be. But 20 minutes is not really enough time to actually get the whole picture of what you're looking at.
Oh, my goodness. Would you say that because of the scheduling and the insurance reimbursements and just how the hospital system is set up, from your experience with the clinical side, what do you believe can actually be accomplished in 20 minutes, whether you're a nurse or a physician?
I think if from the medical professional side, I think that a lot could be accomplished in 20 minutes if your patient comes in with an agenda. If they come in with a, this is what I'm looking for, this is what I'm asking for, all of those things. I also think that what I really love now that they're doing is that they are scheduling for you. I think we talked about this last time, that they're scheduling for people to have their labs drawn prior to an appointment with their physician, which I think is phenomenal, because now we're not just wasting an appointment to say, okay, well, this is the labs that I'm going to draw, but the doctor or the physician actually gets a baseline prior to you even coming in. So now those 20 minutes is not just me telling you what I'm going to do, because that's one appointment. Then you got to schedule another one, which we already said would be God knows when. But now, given in that time frame of that time that you're going to be waiting for your appointment, you could go get your labs drawn and you could evaluate, because now they have a lot of apps where you could receive your labs in almost in real time to your phone, and you can kind of do some looking up to see what's going on and all of those other things, and your doctor now has it. So when you go to that first appointment, you're able to get to the nitty gritty of what we're here for, what's normal, what's abnormal, what are we going to do about it, and when is the next follow-up. So if that happens, I believe that a lot can happen in 20 minutes. But if you go in underprepared or not really knowing, or just kind of like, something's wrong with my body, I don't know what's wrong, then now I got to take, it's going to take a while for me to figure out, okay, so where's the pain? Where's the this? How long has it been hurting? Compared to you coming in and saying, I've been having this pain in my upper abdomen for 6 weeks now. It started off as this, it moves over here, or it stays right here. Now you're giving me, as a medical professional, the whole picture. So I could say, oh, okay, now let's go and do this based on the information that I have, instead of me having to pull and fish information from you.
I'm so glad you landed there. Okay, so let's talk about it, because these are the things people don't know specifically about pancreatic cancer. These are the signs and symptoms that you need to pay attention to, whether you know if it's pancreatic cancer or not, so that when you go to, and God forbid, I pray you don't experience this, but let's say you or your loved one experiences this, these are the things you would go in to report to your physician. If you have sudden weight loss out of nowhere and you cannot regain the weight. When my dad noticed that he lost 10 pounds out of nowhere, and he couldn't put that 10 pounds on for months. He ate whatever he thought he could to put that weight back on. And nothing he did worked. If you are constantly vomiting, if you notice that your stool is dark, y'all, this woman here is the reason why I check my stool. Every time you have a bowel movement, check your stool before you flush it.
Look at it.
Look at it.
I'm going to just say this one story real quick. So my family, I feed them corn. We all know corn is not really a vegetable or anything like that. It's just there. But for me, I use it as a marker. So again, you gotta kind of throw stuff in there. So I would feed them corn at least maybe once every 2 weeks or something like that. And they would eat a little bit of the corn, but not the whole thing. And so one time I asked them, when you go to the bathroom, do you see it in your stool? And they was like, Mom, or babe. And I was like, well, that's the reason why I'm feeding it to you, because I want to know, how long is it taking for it to pass through your digestive system? So look for things that, corn is a great one, to see how long is it taking to pass through. And at first they would be like, I don't know. So now they've gotten into the habit of looking to say, yep, Mom, we ate corn yesterday and it came out today. So great indicator as well.
I love that because pancreatic cancer is a GI issue. So you want to, it's a part of your digestive, it's an accessory to your digestive system in the way that it functions.
Yeah.
So you want to definitely know what your intestines have going on. You want to know if your body's properly breaking down its food. And if your pancreas has any form of dysfunction, it's going to show up in your urine because you'll have darker urine, and it's going to show up in your stool. So please check behind yourself every single time you go to the restroom. Fun fact, it's embarrassing, but it's hilarious. The reason why it was hard for me when Shani first told me to do that is because I grew up being afraid of poop. Like it's when I was a toddler, my mom said one of the issues with potty training me was that I was afraid of my own poop. And I grew up, even into my adult years, I was like, I don't want to see it. The fact that it even comes out of us, it's like, why, Jesus, why we didn't have another way of getting rid of waste? And I'm just like, oh my gosh. But when Shani told me to start doing that, I did adopt it. And then because of my dad's experience with pancreatic cancer, now I'm every single time I make sure that I check. I'm like, okay, this is the color it should be. There's a difference between whether or not it sinks or floats. That lets you know if there's too much fat in your system. There's a lot to be said by your stool. So please check your stool. Please check your urine. Your urine should not be dark. If you're not drinking enough water, you'll know because it'll be too dark. If there's blood in your urine, that should alert you and let you know that something's wrong as well. Another system you need to check for is if you have pain in your mid abdomen and in your mid back around the kidney area. That will let you know something is wrong as well. Why should you check that area for pain? Because your pancreas is hidden behind your stomach and is closer to your spine and your kidneys. So you are typically going to have pain whether you have pancreatitis or if you have pancreatic cancer and there's a tumor resting there, you'll experience pain in those areas. If you have a sudden onset of diabetes, you ain't never had diabetes before in your life, and now all of a sudden you got diabetes, that's a sign and a symptom. And there's one more, I can't recall off the top of my head, a symptom that you should pay attention to, but the sad thing about pancreatic cancer is that those symptoms typically don't start until very late stages of it. If you have early onset pancreatic cancer, you're typically going to be asymptomatic. So my recommendation is that you just regularly get checkups. Mm-hmm. If you're getting blood work done, that's great. But my dad's blood work and many others, they haven't had their cancer caught by their blood work. It was caught by a CT scan because they were already having symptoms by that point. So when you experience symptoms, you want to pay attention and be self-aware. What is a regular for you? Pay attention, your joints, everything. Is your skin regularly dry? Is it regularly oily? You should know your body in and out. And whether you're a man or a woman, you should be checking your body once a month. They tell women all the time, check your breasts, right? Well, men, y'all have chests. Check, palpate your body. Correct. Make sure that you get familiar with, well, how does my body regularly feel every single day? And that way, when you go to the physician, you can report the changes you've experienced. And now you're not being gaslit on whether or not it's in your mind.
It's just something else. Or, oh, the pain just started today. Which, oh, well, you just telling me that you having pain, but you're not telling me how long. Then I'm going to tell you, we'll watch it for a couple of weeks to see if it goes away. Does it go away when you take Tylenol or Motrin or Advil or whatever it is that you're taking? So you're absolutely right. I believe the other symptom would be recurrent pancreatitis.
Yes.
Of course, kind of would be related to pancreatic cancer, right? Because it's something going on with your pancreas, or cholecystolithiasis.
Now that's a GRE word. Please break that down for us.
It is issues with your gallbladder. So
Mm.
gallstones and all of those other types of things, because like you're saying, it is very adjacent to the pancreas and the stomach. It's all in that little area. So if you're having recurring issues with those, not just like one occasion, but if you're like having recurring issues with that, then that is literally something going on with your pancreas directly. Pancreatitis and gallstones or anything dealing with your chole system, and onset of diabetes. All three very, very related to your pancreas.
Thank you so much for watching Beyond the Diagnosis. Raeshon and I had so much fun with this one, and we are just getting started. In part 2, we are getting into exactly how to maximize those 20 minutes with your doctor and how to understand your labs so you can walk into every appointment more prepared and more confident than ever before. You do not want to miss it. If this conversation helped you, please subscribe, drop a comment, and share it with a caregiver who needs it. Subscribe so you don't miss part 2. See you then.